you get one line, one dogma, that means you will have that really a very dark vision for the future. I do believe in diversity.
And in terms of breast reconstruction, what is a new strategy, new things which you could do for the breast reconstruction? Mustafa, I'm so happy that you managed to come to celebrate with us this 10th anniversary of the Moscow Breast Meeting, because you have been many times, but the last time it was 4 years ago, unfortunately, because of the different kind of situation. What have been changed in this year?
I'm so glad to come back after 4 years. It was the pandemic and then was the political situation, so we couldn't really fly it easily to Moscow. But I'm so happy that I could make it. And what I notice is the level, the scientific level, honestly, not only, of course, the international speaker, but also the local speakers, the organization at whole, the level of the lecture itself, it's much higher. Every time I come back, I see that it's like like a little kids, but a growing up. And it's very nice to see that the 10th anniversary of Moscow meeting was the growth of the level in everything really.
Thank you very much. In terms of the breast surgery, was it any huge changes which impact your practice in last 10 years?
I think diagnosis of the BLCL and all the discussion which was around that, it changed a lot of our approach to the breast implant patients. Of course, in the beginning, it was like a panic. We didn't know what to do. And everybody tried really to do something else quickly, and it changed everything that we learned. And then after like a couple of years, we understood the disease. We know that the risk and which kind of implant. And I think even if it was like a panic moment, but thanks to that, the patient are more aware about risk of any implant anyway. And it's a medical device, so we have better practice, we have better follow-up to our patients, and definitely the safety and the new product of implant, it add more security to our patients. So I think even it was a difficult time, but it has added really more value to our result and also the safety of the patient.
Great. Well, do you think that the new implants, like light implants, does it make a revolution in breast enlargement and in breast reconstruction?
Well, if I look back the last like 10, 15 years, it was not that much innovation in the breast implant. There was the shape, there was, the size, etc., surface somehow. But the gel, it was always silicone implant, and kind of cohesivity get different with the years. But having this combination between the silicone, cohesive silicone, and also the air spheres, it's completely new. There's something really innovative, and will add, again, better outcome for the patient, because it's not only 30% lighter. I explain in all my lecture that also the pressure will be 50% less. That means the quality of life of our patient will be better with less weight on the shoulder and the body, but also the fact that the atrophy of the tissue will be less due to the less pressure. That means complication will be less, and maybe even rupture of the implant will be less in the future. So it's a really added value to our patients.
And in terms of breast reconstruction, what is a new strategy, new things which you could do for the breast reconstruction?
I do believe the more, direction to pre-pectoral pocket, there's something emphasized and well accepted nowadays. And then the introduction of the new implants. In some situation, we still maybe need an extra help with a mesh or EDM or a scaffold. But I do believe again, using the B-Light implant for a breast reconstruction patient is extraordinary. Why that? Because breast reconstruction patient need bigger implant, larger implant. So having lighter implant with less atrophy of the skin and subcutaneous tissue will be very beneficial for those patients. I'm very convinced about that.
Will you suggest for the young surgeon to start with the B-Light implant or with the let's say, with the basic implant for the beginning?
You know, things change. In the past, you have to travel far away to get some knowledge. But now knowledge is very accessible. We travel the whole world. Company, they have like a educational program. I mean, look what you organize in this meeting. You brought like a bunch of great plastic surgeon from all around with their experience on the Belite. And we give all the tips and the tricks and the pitfalls. So any surgeon honestly can really start without any problem, with the help sometimes of the delegate of the company. But all the tricks was presented, and it's really very safe to start with.
So what will you recommend to the young plastic surgeons in terms of education, in terms of practice abroad?
I think education is an ongoing process. I don't believe that everybody knows everything forever. I mean, even us that we travel a lot, every time we travel, we learn something and we add it to our knowledge basket. So I definitely recommend to any plastic surgeon to keep this kind of educational program as related to companies or one of those scientific meetings, follow the courses in order to improve his knowledge to serve the patient better. After all, we need just, happy patient and safe procedure.
And in terms of school, like European school and American school, which one is the superior compared to in breast anesthetic and in reconstruction?
Look, I can't really talk about superiority. I think this is not a right term. Let's say that there is differences, and yeah, we can accept those differences and respect it. I don't want really to convince my American colleague about my European vision and vice versa. The only thing that we have to share the experience and the expertise in order to make better outcome for our patient and safety. We have our culture. Our patients, they are different. They have also different expectations. And I think this should be respected. And sometimes among Europe itself, we have some differences. So I think diversity is very major issue in order to get better evolution. You get one line, one dogma, that mean you will have that really a very dark vision for the future. I do believe in diversity.
We will be preparing the next decade of the Moscow breast meeting. What will you present next year for, for our participants?
Of course, the beauty of your meeting, it has combination of aesthetic and reconstructive. And probably next year, I would love to present much more oncoplastic procedures, which is very valuable technique, and we get it more and more in our hands done in Brussels. And obviously, once again, the challenging cases, the mastopexy, post-massive weight loss, they are very difficult patient, will be very nice topic for next year.
Mustapha, thank you very much for coming, for helping, for showing the surgery masterclass, and we appreciate it very much that you very open to share your experience, and definitely we're waiting for you for the next year.
Thank you, Olga. We really appreciate your hospitality and the invitation, and hopefully see you next year.
Thank you.